Almost all urinary tract infections are caused by bacteria, the most common being Escherichia coli. These are common bacteria that are present in the environment and around the genitals and the anal area of the dog. They constantly enter the urethra from the outside. Each time the dog urinates, these bacteria are dragged by the jet again outward. If the dog does not urinate often enough, the bacteria can reach the bladder and cause an infection. In dogs, the prostate may also be affected. Sometimes, the infection can then ascend through the ureters and affect the kidneys. The medical terms are cystitis, in the case of bladder infection, prostatitis in the case of prostate infection, and nephritis in the case of infection of the kidneys. All are different forms of urinary infection and can appear in isolation or at the same time. Male dogs have a much longer urethra than females and often urinate more frequently. For that reason, the bacteria have less time to advance through the urinary tract before being dragged by the urine stream, so they suffer urinary infections much less frequently than females. Bacteria can enter the urinary tract differently, through the bloodstream. The kidney is very active and constantly filters the blood, so it should not surprise us that it is one of the first organs to be affected by this type of infection. In these blood infections, many types of bacteria may be involved, which normally enter the bloodstream from the periodontal tissues affected by a chronic infection or through an open wound. This form of nephritis is characterized by permanent kidney damage from a low-intensity but prolonged bacterial attack. The pH of the dog's urine is influenced by feeding. A diet that alkalizes the urine facilitates the appearance of infections. Another factor is the frequency with which the dog urinates. Bacteria cannot be washed out unless the dog urinates frequently. This situation occurs, for example, when the dog stays too long locked, or when he suffers from diseases that prevent him from moving properly, such as osteoarthritis, and, therefore, is reluctant to move. Some diseases determine that the dog is more prone to suffer urinary tract infections. Obstructions of the urinary tract caused by tumors or stones are quite frequent. Hormonal changes can cause an enlargement of the prostate. Bacteria that can specifically cause certain infectious diseases such as leptospirosis can also lodge in the kidneys. Would you like to have more updated information about your pet? Visit the website that is located below in the description of this video. Do not forget to subscribe to the channel, comment, and share the video. You are very well, thank you.